My name is Kristy Chambers. I am the Stroke Chest Pain Coordinator here at Ogden Regional Medical Center. I am the one that gets to pay special attention to specific disease process patients. So stroke patients, chest pain patients, all of our acute coronary syndrome patients, and make sure that they are getting the standard of care that is current evidence-based practice. A lot more common than people think. It is definitely a myth that heart disease, heart attack is a man's disease. We watch it on the movies where the man clutches his chest and falls to the ground. With women, it's more common. Actually, more women die from heart disease than breast cancer, all cancers combined, and Alzheimer's disease combined as well. So it is the #1 killer of women. Absolutely, absolutely. And it's probably, all in all, typical. So the chest pain, the complaints of, I feel like I've got an elephant sitting on my chest, or I've got a belt tightened around my chest, that chest pain and tightness is still relatively common in women. The problem is that is such a distinct sign that both men and women recognize that as a critical problem that they need help immediately with. Unfortunately, women more than men tend to have what we call atypical or subtle signs of heart attack. And this can be extreme fatigue. This can be cold sweats. This can be epigastric or stomach pain. This can be a lot of different, more subtle signs that just kind of nag on. Maybe the pain isn't as intense. It could be in an arm, one or the other arm. It could go up into your neck or your jaw. It just can display in women slightly different. And so women are notoriously care providers, and we care for everyone else, and we tend to put our signs and symptoms to the side and say, oh, I've got to get, I can't go in and deal with this now, I've got to get the kids taken care of. And so we tend to wait, and we don't immediately call 911 like we should. I think we really have to just listen to our own bodies, and if we feel like this is something that I have never had before, then we need to just call 911 and get the ambulance there. Because if time is heart muscle, every second counts, and so if we can get the care that we need immediately, we're going to survive that heart attack without as much heart damage and continuing heart failure problems throughout the rest of our lives. Extremely important. And that's something that we can't modify. We call risk factors modifiable risk factors or non-modifiable risk factors. And family history, our genetics, we can't do anything about, but we can sure investigate and know that that puts us in a higher risk category if we have siblings and parents that have also had heart disease or have died from heart attacks. Every minute counts. I cannot overemphasize that. If we can catch a heart attack within the golden hour, even 90 minutes, we have skilled cardiologists, interventionalists that can go in, we can get patients into the cath lab, we can get those arteries opened up, and we can get stents placed to reperfuse that heart so that heart muscle doesn't die. And so it does. Every second counts. I just think women work so hard and care for our families, and we raise our kids, and we think of this, this retirement or this joy of playing with grandkids, and if we don't take care of ourselves, our quality of life isn't going to be there. Call 911 and take care of ourselves. Eat right, exercise, do all those things we know we're supposed to do. And if we have pain, atypical pain, subtle signs and symptoms that are just doesn't feel right, call 911.